So this is a loading technique to the upper part of the back part of your head. So that's called the suboccipitals. So what we're trying to cover is this area right into here and right down into here. So this band right here is the area that you're trying to cover. So what you're going to need is a ball that kind of looks like this, a double ball or a peanut shape. If you don't have this, but you do have two balls, what you can do is you can put it in a dress sock, let it drop all the way down and tie it so it kind of gives this impression or this shape. Or what you can do is you can take two balls and then you can tape it up together so it looks like this. So you're going to set yourself up in this position. Right now my knees are bent with my feet flat. This takes pressure off of my back. If you have pillows or blankets, folded up blankets you want to put underneath your legs so they're elevated like this, that works just as well. What I'm going to do now is I'm going to find that area that's sensitive by tilting my chair up towards the ceiling and bringing it down towards the floor. Wherever I feel more load, that's the position I'm going to hold. Then what I'm going to do is I'm going to apply a little bit more pressure by shifting my face straight down. So I'm doing a face tuck. I'm smushing my face downward and I'm just going to hold that position. As it desensitizes and becomes a little bit more comfortable, then I can find another area. So I'm going to relax. I'm going to tilt my chin down towards my chest a little bit more. And I feel a little bit more load there, so I'm going to hold it there. And then I'm going to smush my face down a little bit more and hold that position. The other modification that you can do with this is you're going to shift left and right. So you may not see it on camera, but what I'm doing is I'm doing micro movements. So I'm shifting my face down and then I'm slightly shifting towards my right side and slightly shifting towards my left side. When I'm doing that, I'm going to feel a different load in that target tissue, which is the back part of my neck. And I'm just going to hold that there, and then I'm going to shift my face down a little bit more. So again, the steps is number one, you're going to tilt your chin up or down until you feel the load, and then you're going to smush your face straight down. If that's okay, another modification you can do is you can shift your chin up or down until you find the load, then shift your face left or right, and once you feel additional load, then just smush your face straight down. So step one is chin up, chin down until I feel the load. Step two, shift my head left or right until I feel an additional load. And then step three is I'm going to smush my face down even further, applying more pressure. The fourth load that you can do on top of that is you're going to look down and you're going to look up. So you may not see it on camera, but you're going to look down or look up. That's actually going to get a little bit more load, a little bit more stretch out of the tissue. So again, first thing, chin up, chin down till I feel a load. I feel more load right there. I'm shifting left or right until I feel more load. I feel more load when I shift towards my left. I'm going to hold that position, smush my face some, hold that position, then look up, look down, look up, and look down. When you look up and down, go about 3 to 5 times and go nice and slow. It's not a race.